Well, for more on the global spike in coronavirus cases and deaths, Dr. Irshad Ali Shaikh joins me now from Ankara. He is a health security lead and interim head of WHO Turkey. Doctor, we've seen the largest increase in reported cases globally of coronavirus in the last 24 hours. Why do you think that is?
I think, thank you. First and foremost, our heartfelt condolences to the government and people of Turkey over loss of life in floods in Bursa. Coming back to the other calamity of this pandemic, the increase is because of two factors. One, many parts of the world are seeing the relaxation. However, unfortunately, the Americas, South Asia, and the Middle East is seeing the peak now. So today, 2 out of 5 people are living in countries where virus is resurging and they are still peaking. So you can imagine about 20% of the population globally in these countries, and these countries are large populations, high density, with relatively weaker health systems. So as your reporter before me was saying, literally we are moving to a perfect storm, especially as we get closer to the fall season when we are expected to see flu, and again the highest population for COVID and flu both being elderly above 65. We are really entering a worrying stage. As our Director General said, a new and dangerous phase is coming ahead of us. We may be tired of the virus, but virus is not tired of us at all. And actually, it's maybe waiting to attack with its worst vengeance in the coming months.
Yeah, it certainly doesn't seem to be going away anytime soon. Despite the increasing numbers of cases, many countries are continuing to open up. Spain, for example, has ended its state of emergency and opened its borders to most European countries. Do you think that this is coming too soon, reopening countries?
I think it's very difficult to say whether it's too soon or too late. But what is clear is that every country will need to adjust its dial. If we see a slight increase, we increase slight smart lockdowns. I think that is the word that we have learned in the past few months, from en masse lockdowns and total lockdowns to smart lockdowns, smart quarantines that we are seeing in Turkey, as well as in these countries where they see the spike. Look locally, literally look locally at nationally sort of and regionally and globally. Look at the populations where the transmission chains are happening and make efforts through quarantine, testing, isolation, treatment to block these transmission chains at the local and provincial levels before they become a national hazard.
You talked about the concern about moving into the fall and flu season and people with weakened immune systems who we know are most vulnerable to this illness. What happens if countries can't get a handle on this first wave of coronavirus and then the second wave we keep talking about hits?
I think that would be the worst case scenario, a perfect storm, but we know we can avoid that. We have for flu vaccination, so increased flu vaccination, especially in high risk populations, nursing homes, long term care facilities. But most importantly, the three uh, interventions in our arsenal, 3 Ws, what we are calling: wash your hands, watch your distance, and wear your mask. So these are the 3 Ws. If we practice, we can literally make a dent, and coupled with vaccination for flu and increase risk communication and community engagement, we can really prevent or mitigate at least the second wave from really
Right.
being a hazard beyond health system strain capacity.
Okay, I like that. The 3 Ws, easy to remember. Dr. Irshad Ali Sheikh, thank you so much.